This presentation is about street children in the context of international social work. So, a working definition for street children is children who spend most of their time on the streets, whether or not they are working. These children have tenuous or no connection with their families, and they have developed specific survival strategies for living on the street. This is a working definition because street children covers a huge swath of people across the globe that are in very different contexts and are on the street for different reasons. One of the distinctions that is made is children on the streets versus children of the streets. So children on the streets might be engaging in labor or other activities, but they have a home, and children of the streets are living there full-time, day and night. The prevalence of street children is unknown. Often there's a figure quoted of 100 million street children, but that is based on an estimate from 1989. There aren't better, more updated estimates because street children are such a dynamic and mobile population, and these numbers can fluctuate a lot. So if the seasons change, or if a major event like the Olympics or some kind of international occasion happens, the government might remove street children before that event for optics. This is also often an invisible population. So when researchers are trying to count children, they won't see the ones who are inside on a given day or at a given time. And some groups of children can be less visible on the streets, such as girls and children with disabilities. And street children experience high levels of stigma and abuse and violence. And so they're often suspicious and wary of adults and outsiders and attempts to count them. The Consortium for Street Children has attempted to improve the tracking and statistics for street children across the world, and this is a map, an infographic from 2016 that gives a little bit more context of approximately how many children are in the different countries across the world and some facts about what they are doing. Issues and challenges that street children face when they are living in destitute situations. They are exposed to a lot of danger and violence. So this impacts their health. A lack of food causes growth and nutritional disorders. They're susceptible to physical injuries, communicable diseases, and death. They experience violence and sexual abuse from authorities, other adults in the community, and their peers, and can have sexual and reproductive health disorders and sexually transmitted diseases such as HIV and AIDS. These are stressful circumstances, and that leads to mental health issues such as trauma and PTSD, and the stress can increase the risk for other psychological disorders, and the abnormal environment also leads to developmental issues. So children are not getting their needs met in multiple realms, and that impacts the way that their brains develop. This can also lead to substance use because they're lacking the ability to self-regulate. Sometimes they're using substances to cope. They might also use them to fit into the street culture or as entertainment. And sometimes substances are more affordable than food, so they are an attractive option. And this all stems from the lack of resources, which puts them in danger of being exploited as child laborers, having to engage in transactional and survival sex, starving, exposure from the elements, for being sleeping under bridges and in abandoned buildings, a lack of healthcare access, and stigma. Some evidence-based interventions include peer education. So this comes in different forms and has different names, including street-based approaches, peer-based, non-formal education. But the idea is that these children are more trusting of one another and can disseminate information such as how to prevent HIV through safer sex methods and spread that message amongst themselves. There are also family and community level interventions. The idea is to raise the family's functioning or socioeconomic status so that they can care for their child again. On the community level, you can also create drop-in centers where youth are able to come voluntarily and access resources such as food, and that also brings them into contact with social workers or others who can help them transition into a different life. And on the preventative level, you can have social development policies that address the underlying issues such as extreme poverty, but these do not serve the immediate population of street children and are not guaranteed necessarily to prevent children from coming onto the street. Some of the responses and resources that are available at the local level are those center-based and street-based approaches. On the national level, you have child welfare programs and policies. And on the international level, there are organizations such as UNICEF and the Consortium for Street Children that provide advocacy and guidelines to governments and agencies across the world. Gaps in resources are often due to stigma. So youth can be seen as delinquents and nuisances and disposable, and in those cases, they are often not given any kind of resources. Sometimes it is also just due to what is available in countries like Bangladesh that are severely impoverished. You're going to have different approaches than in a country like South Africa that does have intense poverty but also has extreme wealth and extreme wealth disparity. So one recommendation for South Africa to help its street children population was to provide a basic income grant so everyone had a basic level of living. That just might not be available in other countries like Bangladesh. Some practice program and policy suggestions for social workers. On the practice level, it is important to support youth autonomy and self-determination. Research has found that institutionalization is very harmful to street children, and it doesn't help them long term. Also, meeting the children where they are at, and this means both physically and emotionally, so coming to them on the street, and also emotionally being aware that they've experienced trauma and rightfully are afraid of authority figures. On the program level, providing high quality, appropriate alternative care, such as those drop-in centers or emergency overnight shelters, and improving data collection for this often invisible population. On the policy level, the recommendation is to channel funding to support families rather than sending that funding to institutions. Again, we want to prevent unnecessary family separation and instead help the families care for their own children. And these recommendations come from, in part, the key recommendations seen here that were given to the UN by a global organization of 256 organizations, networks, and agencies. And this has been implemented into the 2019 United Nations General Assembly Resolution on the Rights of the Child. Thank you so much.